Committee is reconvening the hearing for Council Bill 17-0065, Ordinance of Estimates for the fiscal year ending June 30, 2018. Colleagues, I apologize. We're about 9 minutes late getting started. We are starting off the day with the Health Department, all services. I should note before we begin that we have a panel today at 12:30 to 3:30, which is youth services. There are 7 agencies presenting, and one of which is the Health Department. So anything youth services related within the Health Department's budget, I'm going to ask that we table those questions until that panel at 12:30. I'm joined today by Council President Jack Young, 2 to my right. To my immediate left, Councilman Leon Pinkett, Vice Chair of the committee from the 7th District. To his left, Councilman Ryan Dorsey from the 3rd District. To his left, Councilman Chris Burnett from the 8th District. 3 to my right, Councilman Zeke Cohen from the 1st. Councilwoman Shannon Sneed from the 13th. Councilman Robert Stokes from the 12th. And Vice President, Councilwoman Sharon Green Middleton from the 6th District. To my immediate right is Marguerite Curran, staff to the committee, who has been absolutely phenomenal, like 5-star rated this entire week. Thank you, ma'am. Representing Mayor Pugh is Karan Banks. I believe that Kara Kunst, Legislative Director to Council President Young, will be joining us shortly. So we've got the Health Department. Dr. Wen, thank you for coming in. I'm going to ask that everyone who's testifying today, please speak into the microphone. These hearings are being streamed on TV and on the internet. If I politely or impolitely interrupt you, it is because I cannot hear you, and I am going to cut you off and ask you to please speak into the microphone so that we can hear you. Those folks presenting, please feel free to stay where you are in your seats, or if you feel so inclined, you can get up to the podium. But again, you've got seats, so feel free to stay there. Dr. Wen, I'm going to ask you to take it away. Please feel free to sit if you like. Before you get started, Dr. Wen, I'm going to ask that you introduce all of your staff that you have here with you, just full name and what their title is. And then we're going to have you get into your presentation, and we're going to ask that you keep your presentation to about 15 minutes, and then we're going to get right into questions from the council. Please take it away, ma'am.
Wonderful. Thank you very much, Chairman Costello, Vice Chair Pinkett, members of the Budget and Appropriations Committee, Council President Young, and all the City Council members who are here. It is our honor and privilege to be here today to talk about the work of the Baltimore City Health Department. I feel extremely humbled every day to work and to represent the incredibly hardworking, dedicated employees, the men and women who work on the front lines every day to protect health and well-being in our city. And I want to introduce, we have a lot of people here from the health department, so it might take me all 15 minutes to introduce our staff. I think I will introduce the staff who are here in the front, if that's okay with you.
Please, everyone, and we won't hold it against your 15 minutes, Doc.
All right, excellent. I would like to introduce Ryan Heminger, who is our Chief Finance and Admin Officer. You know Mary Beth Haller, Assistant Commissioner for Environmental Health. Hyung Tan is our Deputy Commissioner for Aging and Care Services. Don O'Neill is our Deputy Commissioner for Population Health and Disease Prevention. Olivia Farrow is our Deputy Commissioner for Youth Wellness and Community Health. I also want to point out Kristen Raskowski, who is my Chief of Staff. And then we have a number of other staff here from the Division of Care and Aging. We also have Jeff Ambrose, who you know as our Legislative Director. We have other folks here who are Assistant Commissioners overseeing other aspects of our agencies, who I will introduce later.
And it's nice to see Jeff Ambrose and to know that there's life after working for Councilman Kraft. And we're also joined by Councilman John Bullock from the 9th District.
Hello. All right, so what I would like to do today is to present on state of health in Baltimore, to give you a snapshot of what is happening to health here in the city. I'd also then like to discuss our Healthy Baltimore 2020 blueprint and how that aligns with our funding priorities, and to give you an idea also of the accomplishments in FY16-17, because that gives us an idea too of what it is that we're looking for, what it is that we're looking forward to. I'll then talk quickly about the FY18 challenges and priorities, especially with the shifting federal landscape and what we're facing there. Quick word about the Baltimore City Health Department. You may know that we are the oldest continuously operating health department in the country, and we've actually been present since 1793. And what I'm so proud of is that we have a long history of innovation and of doing things that other jurisdictions and other cities and counties across the country found it too difficult to do. And it's with the help of my predecessors and yours that we've gotten incredibly difficult things done, like needle exchange. We were one of the first jurisdictions in the country to try it. And as a result, I want to start with one statistic, which was that back in 1994, the percentage of people living with HIV from IV drug use was 63%. That number in 2014 is 7%. 63% to 7%, that's the type of work that we do because we're not afraid to take stances that may otherwise seem challenging, but are the right thing to do when it comes to saving lives. Now, our principles as well, I want to illustrate because this is why we're all here at the end of the day. First is going to where people are, recognizing that it's not just about making people go to hospitals. If that were the case, we should have the best healthcare in all of the country because we have the best hospitals here. But we don't, as you'll see, and it's because we have to go to where people are, not assume that they'll come to us. We also are about protecting and serving the most vulnerable. We, the Baltimore City Health Department, are the safety net for all the people that we serve, our youth, our seniors, and everyone in between. We believe in engaging in health in all issues. The fact that if we care about education, then we need to care that our children are healthy. If we care about public safety, then we need to care about our policies that have resulted in people with mental illness and substance addiction in our jails. And then, of course, we're scientists and public health officials, and so we aim for science in all policies and in making sure that we're promoting data and best practices. I show you the next slide about what kills residents in Baltimore City to illustrate why it is so important that we do the work that we do. Our top killers, as you see, are unfortunately all medically related. Chronic diseases like heart disease and cancer are our top killers, and overdose is now our third killer here in our city. These are data from 2014. The numbers have actually escalated since then. In overdose, we have more than 650 people who died in our city last year from overdose. More than actually almost twice a day, or 2 people a day who are dying from overdose. You know, so many of these issues here that you see, heart disease, cancer, stroke, etc., seem like they're predicated on lifestyle. And so many times people talk about the choice that people have in choosing a certain lifestyle. But I would argue, and all of our work would argue, that that choice is predicated on privilege. And that privilege is what we all have to work to change. State of health in Baltimore City. So this map that you'll see is pretty far away, and I actually didn't color code it or even put a legend on the map. And that's because it actually almost doesn't matter what the legend is. Because no matter what I choose, in this case, this is life expectancy, no matter what we choose, if I showed a map of infant mortality, a map of poverty, a map of homicide, a map of overdose, it would actually all be the same, which you all know in your work that where someone lives, where a child happens to be born, unfortunately determines the outcome of their life. I mean, I think it's unconscionable that we have this 20-year difference in life expectancy. I mean, what does it mean when a child born today in one area can expect to live 65 years, and a child born just a few miles away can expect to live 85 years? It's not about the health care that we get, because we've got great institutions. It's about the other factors in our lives. So a few other data points that are important. 21,000 of our residents use heroin. Actually, many more, tens of thousands, use other substances. We have over 600, again, who died from overdose in 2016, more than the number who died from homicide last year. We have double the national average in terms of the number of babies born with low birth weight, which is a health problem, but also an economic problem as well, because these kids will require more intense resources and have decreased educational outcomes later. we also see, and I wanted to show you the next two statistics to illustrate that, yes, absolutely, health is tied to poverty, but health is also inextricably linked in this city to racial disparities as well. That there are, of the 13,000 people living with HIV here, 85% of them are African American, and 1 in 3 of our African Americans, compared to 1 in 12 of our whites in the city, live in food deserts. So my lessons from all of this is that health is not just about the health care that we get, it's about all these other factors, and also that there are huge disparities that exist. And that's why we have to do the work that we do to not only fight for health, but social justice as well. So I show you now Healthy Baltimore 2020, and I'll go into more detail about what this is, but I show you this blueprint because we came up with this blueprint over the last 2 years through a series of community conversations. And our blueprint for health is based on the fact that improving health alone is not enough unless we specifically call out the need to cut disparities. And so our vision for Healthy Baltimore 2020 actually is that we're going to be cutting disparities in half in the next 10 years. It's an ambitious goal, but it's something that we're fully committed to. And I want to illustrate to you next through my next 4 slides about how we're doing this, how we're moving the needle long-term, while also choosing short-term actions that are impactful. And so I want to show you, first of all, with youth health and wellness, something that I'm thinking about a lot now as I just entered my 3rd trimester of pregnancy with my first child. I'm looking at every time I see Councilwoman Snead, or Councilwoman Snead, I see her baby, I think this is what we're all working towards, to have healthy babies. And in 2009 in Baltimore City, we did not do so well when it came to healthy babies. In Baltimore City, we had one of the worst infant mortality rates in the country. And actually, an African American infant born in 2009 was 5 times more likely to die than a white infant. I mean, these are statistics that were not acceptable. And so as a result of a partnership that was formed called Be More for Healthy Babies, together with the Family League, together with Healthcare Access Maryland, we have resulted in a 38% reduction in infant mortality, nearly 40% citywide. I mean, we have to talk about the successes that we have. This is because of the collective impact strategy through Be More for Healthy Babies. This is a result of the work through teaching the ABCs of safe sleep, through home visiting programs, but it's resulted in a record lows in the number of sleep-related infant deaths, as well as a 36% reduction in teen birth rates. And I want to add one more, which is that we have also closed that disparity between Black and white infant mortality by over 50%. Now, there is a lot more to be done because even one baby dying is one baby too many. But we have to look at the fact that actually when you look at sheer numbers, in 2009, 50 babies that would have died in 2009 are now able to live in 2017 because of the work that we've done. And I think it's important for us to talk about the successes that we have, the short-term successes that we have, in addition to how we're able to move the needle citywide. And I think that Be More for Healthy Babies is an excellent example of that we're now scaling up through our youth health and wellness strategy. School health as well. We're very proud of having nurses and nurse aides in every one of our schools. And so we have, every year we have over 350,000 visits for students in our health suites. And the vast majority of these students return to class, which means that we're helping students learn, we're preventing them from missing class and others from missing work. We've been able to achieve one of the highest vaccination rates in public schools across the country of over 99.5%. And by the way, all of this is done at a cost of less than $1 per student per day. That's invested in school health, going to where people are. I also want to mention about our Vision for Baltimore program, because this idea came from some of you on the City Council. I mean, it's another number of what we saw. Less than 20% of children who were getting screened as needing glasses were actually getting them. I mean, that's up to potentially 10,000 kids in our schools who are not getting something as simple as glasses. I mean, I'm all for doing research, but we don't need another study to tell us that if you don't have glasses, I wear contacts and glasses, if you don't have glasses, you can't see, you can't learn, you can't function in school. Maybe you could even be labeled as being disruptive when actually what you needed was glasses. So we started Vision for Baltimore last year, which has now expanded to 46 schools. We've given out 1,500 pairs of glasses, and the idea is that within 3 years, we're going to be doing testing and getting glasses to every child who needs them in every grade, K through 8, in every school, at the school, without the parent missing work or caregiver missing work and without the child missing school. And I think that's an example of our principles of going to where people are, identifying the need and filling it. I want to talk second about our substance abuse and mental health work because this is something that is in the news all the time. Actually, I was just talking to Councilman Pinkett prior to us starting. Yesterday, we had a press conference to announce the standing order, which is I signed an order, a blanket prescription yesterday in our city so that anyone could get Narcan, the overdose reversal medication, without having a prescription. You could just walk into any pharmacy now, as of yesterday, and get this medication. In the middle of the press conference, I saw people going outside and rushing outside, and I was wondering what's going on. And it turned out that in the middle of our press conference, right outside the pharmacy, someone had overdosed. A random person on the street had overdosed. And they were not breathing, they were not responsive, and they would have died in a matter of 2 minutes. But our outreach workers happened to be there. I mean, we were doing a press conference on naloxone. They administered 2 doses of naloxone or Narcan and saved that person's life right there and then. And I think that just illustrates why it is so important. I mean, this could happen anywhere. These are not random people, and that's why it's so important for all of us to carry this medication. So in the last 2 years, we have done over 23,000 trainings across our city, in markets, in public housing, on street corners, and everyday residents, not counting our police officers and paramedics who do this every day. Everyday residents have saved over 800 lives here in our city. There's a lot more to be done, especially because of fentanyl. I show here that if you look at that heroin, if you compare heroin to fentanyl, a few grains of fentanyl can kill you. And fentanyl is now being mixed in with heroin. And so people who are using heroin don't know that there's fentanyl in there, and they're overdosing and they're dying. So we're doing a lot more, ramping up our efforts with our task force, with our Don't Die educational campaign. We now have a 24/7 phone hotline for anyone with addiction and mental health needs that now receives over 1,000 calls a week. We're starting a stabilization center, which is estimated to open in summer of 2018, and we're also focusing specifically on trauma. One of my staff members who is in recovery himself said that it's hurt people who hurt people. I think it's an important recognition of the fact that we also have to be addressing trauma in all the work that we do, and we received a number of federal grants last year to further help us with addressing trauma, including in our students. Third, I want to talk about our work in caring for our most vulnerable with a couple of examples. Citywide Wellness. You know, in public health, sometimes our trajectory is quite long, and we talk about improving food deserts and improving cardiovascular disease. Well, there are tangible things that we've done along the way. For example, we have opened now 11 virtual supermarkets to deliver food to people who are living in food deserts, 18 healthy corner stores to help corner stores become healthier. And we're also starting a billion step challenge, which is involving the entire city, our business communities, our community members in this that's set to launch this summer. And we're looking forward to engaging every member of the city council in understanding more about how to engage your districts and how to get the word out about this as well. Senior programming, the Division of Aging and Care Services, we are proud to have in the Baltimore City Health Department. We provide every aspect of care for our seniors, health, physical health, mental health, well-being, including with serving nearly 260 congregant meals, having a falls reduction program, and reaching our seniors through many other services, including our ombudsman, advocacy, and other services that we'd be happy to talk about more too. Along with this, a couple of weeks ago, the council held a hearing on violence prevention, and so you heard about some of our statistics as it relates to Safe Streets. You know that this is a program that's been called by researchers at Johns Hopkins as one of the most effective public safety strategies in the city. And in fact, that last year there were nearly 800 conflicts that were mediated by our outreach workers, 80% of which were deemed likely or very likely to result in gun violence, something else that we're proud of as well. I want to mention too, for fourth, and this is the last of the slides for accomplishments for disease for 2016 and 2017. So often the work that we do is the glamorous work that gets media, if you know what I mean, the things that happen. But there's a lot that we do to prevent things from reaching the media, from happening in the first place. And disease prevention is one of those things. It's also our mandate to provide clinical services, for example. We have 2 clinics in the city, one on the east, one on the west side, and we provide nearly 20,000 visits for chlamydia, gonorrhea, syphilis, and so forth every year. Over 23,000 HIV tests. We're opening a new clinic at 1200 East Fayette to provide further state-of-the-art care, because we believe that no matter if you're able to pay for your care or not, no matter who you are, you should be able to get the best care possible in a setting that reflects dignity and humanity. And we also have home visiting programs to prevent people from even seeking those care in the first place. And I want to illustrate to you a couple more statistics for why this is so important. And we speak about lead poisoning a lot, and yes, this is a major problem in our city. But as a result of our programs, as a result of our aggressive law enforcement, Olivia Farrow, whom I introduced to you earlier as our deputy commissioner, was actually the first lead paint prosecutor here in the city. As a result of her work and the work of our programs, the percentage of children with lead poisoning in Baltimore has decreased by 95% since the year 2000. There's still a lot more kids who need help, but that's an important statistic that we have to keep in mind. And similarly, children enrolled in our asthma home visiting program have 95% fewer ER visits than previously, which is also something that we find to be important too. To give you an idea of the rest of our disease investigations, we investigated almost 24 outbreaks last year, including meningitis, Legionnaires, C. difficile, infectious diarrhea. We prepared for Zika. We had over 20,000 calls for animal control. Animal control is also in our agency because of the tie between zoonotic or animal-related illnesses and human-related illnesses, as well as the close tie between human violence or violence against humans and violence against animals. And we did over 8,000 environmental inspections, including in restaurants and pools and sanitation and other services, and that is all part of the core services that we have. Which ties into my next slide, and I want to talk about the mandate that we have in the health department, again, because these are not the glamorous things that we see, right? We may see the work that we do in overdose, and it's important, but actually these are the core services that we do every day. We are mandated by the state, federal government, and in our city regs to do disease investigations, whenever there's a question of any outbreak, that is our work to investigate them and to prevent them. It is also our mandate to treat and track and prevent HIV, tuberculosis, syphilis, gonorrhea, and other STDs. Sanitation is another one of them, and we face challenges all the time with actually meeting our requirements. For example, it was estimated by our state and based on our federal regulations that we need about 41 people to do inspections in our restaurants, to do environmental sanitation. We have 19. This is what we do, and I hope you'll see in everything that I've talked about that I'm so proud of our staff for many reasons for serving on our front lines. And I'm also proud of them because we do a lot with very little. We are not at the same level as other cities and counties across the country because of finances, but we make do because that's the important work that we have to get done. We also have to provide safety net services, something I'll talk about in a bit about how we are facing those particular challenges, especially at this time when our funding potentially could be cut on all levels, on state and federal levels. And we are the safety net. I mean, people who don't have addiction mental health services, people who are uninsured, people who don't have dental care and reproductive health services because that's not covered, that's what we do. School health I had mentioned earlier, and I just want to illustrate to you how much we do with very little. Not to mention that it's also our responsibility to respond in emergencies too. So often we think about the frontline employees in our city being fire and police, and absolutely our fire and police employees do incredible work that should be celebrated. I also want to add our health department to that list as well, because these are frontline employees who have to work when there are Ebola investigations, measles investigations, every code blue, code red, and people have to, in snowstorms, when there are patients who need their dialysis and chemotherapy, we are the ones who knock on doors and help to make sure that people get there. In the middle of the unrest that happened 2 years ago, when our pharmacies burned down, it was also our staff who delivered medications to people because they otherwise would not be able to get access to life-saving medications and life-saving food. I show you this graph here because I want to illustrate one thing, which is that our funding is different from every other agency in our city. So in our entire budget for FY17 that's budgeted for $137 million, the contribution from city general funds is $28 million, which is about 20% or 1/5 of our total budget. This is, again, different from all of our other city agencies. About 80% of our funding comes from other sources, from federal grants, state grants, from private grants, et cetera. Now, what this means is that a couple things. First is that I have an incredible team, as I've talked about already, who are amazing at getting grants and looking for opportunities and making sure that we bring these opportunities to Baltimore City. We receive actually throughout in our agency over 50% of all the grants that come to the city. So I'm very proud of our team for being very entrepreneurial and for getting these resources to our city. The problem though is that that flexibility comes with constraints. And those constraints include how do we possibly meet all these mandates? The core services and the safety net and emergencies are all sponsored by city general funds because that's the understanding of what needs to be done in the city. And that includes the constraints that we have all the time with how do we meet our mandates despite these cuts. So my last slide is about our challenges and opportunities, and in particular, our challenges, my last slide, 4 challenges. And I was asked to specifically mention this because of our changing federal landscape. I don't think any of us can not read the news. This is not a partisan conversation, but I don't think that any of us can read the news and not be concerned about what is potentially happening with our federal landscape when it comes to funding for health. Half of our pregnant women, more than half of our children in the city are dependent on Medicaid for healthcare. So what happens if Medicaid is going to be cut? If our budget when it comes to seniors and food are going to be cut, the federal budget for research is going to be cut, how is that going to be affecting us? And so there are a lot of challenges that are coming our way, and we have people calling the health department every single day asking about what's going to happen to the ACA, what's going to happen to their own health care. There was a woman who talked about how she doesn't have time to wait because she has cancer. She can't wait until something changes in the next 4 years because she needs her health care now. That's something that we're very acutely aware of as well as the challenges from our state. We continue to make sure, this is not the case now, but we continue to fight for resources so that the distribution from the state is not by population or by jurisdiction, but rather than by need. That's what we need here in our city. The distribution should be based on vulnerability and poverty and based on need, and we continue to fight for that. Something else I want to mention is that whenever we have current level of service, and whenever you all approve for current level of service, I hope that you'll all keep in mind that especially for an agency like ours that has a relatively small contribution from the city general funds, that actually results in a cut to our budget. Because every year we have increasing costs, and especially because we're getting all these grants, which is great, but the grants are for direct services. And then our admin and operational staff are not increasing along the way. And so we hope that you'll keep in mind that a cut to, or a level funding, CLS, is actually a cut to our budget. So I show you this chart on the right. It's a little bit hard to read, and I want to explain that we mapped out what happens between 1996 and 2016, the trend that's been happening over the last 20 years, which is that the percentage of the budget from the city that goes to health has been steadily decreasing, that it's been decreased by 30% actually in the last 20 years. This is a trend that's continued, and it's because of the ultimate problem that there is no face of public health. It's hard to make the point for what is public health when there's no face of someone who could have gotten poisoned in a restaurant but didn't because of our restaurant inspections, or could have gotten shot but didn't because of the mediations that we did. And so I'll wrap it up and just say that, I'll quote Congressman Elijah Cummings, one of our heroes in my concluding statement, which is he always talks about what we do as not only for this generation that's here, but he talks about the work for generations that are yet unborn. And I think that is ultimately what we do in the health department. We are protecting, we are advocating for health, for social justice, but ultimately the work that we do is for the next generations and protecting their health and well-being as well. So I thank Chairman Costello again and all the members for allowing me to make this presentation, and I look forward to answering your questions at this time from a seated position, if that's okay, Councilman.
Thank you, Dr. Wen. I got a very brief comment because I'm going to be in and out with budget-related discussions outside of the room. But Dr. Wen, I wanted to thank you. Mary Beth, wanted to thank you. Your agency is another one of the what I like to refer to as high-performing agencies in city government. Jeff has been absolutely fantastic to work with. We have had a number of discussions, whether it's you, Dr. Wen, Mary Beth, Jeff, whomever else, at 3 in the morning, at 9 in the morning on a Saturday because an event and there's an issue, and you have always been extremely responsive, and I really do appreciate that. The customer service is top notch, and it's my hope that other agencies in city government can look at the model that health department uses in terms of customer service and can emulate that. Vice Chair Pinkett.
Thank you, Mr. Chair.
Oh, and pardon me, Councilman. I want to introduce Councilman Brandon Scott from the 2nd District. We're also joined by Councilman Ed Reisinger from the 10th District.
And Dr. Wen, I second the sentiments of Chairman Costello. It is a pleasure to work with your agency and your entire team. I just wanted you to comment on Service 316, specifically the cuts to Safe Streets. No surprise. Being that we recognize violence as a public health issue, can you describe for us, and please don't be gentle, the impact of making these cuts to Safe Streets as it relates to violence as a public health issue in the city of Baltimore?
First of all, thank you for the important question, and also for your leadership, Councilman Pinkett. Safe Streets is one of the programs that we are very proud of in the city because it is evidence-based, because it has been shown to make an impact. And I turn to data when in doubt. I turn to data for this. There was a study done by Hopkins that showed that as a result of our Safe Streets program in the last 10 years, that we have reduced shootings in those areas by 27%, in our Safe Streets areas by 27%. Again, Daniel Webster from Johns Hopkins has called Safe Streets to be one of the most effective public safety programs in our city. And not only to mention that it's not just about, reducing shootings in those areas is very important, but there was also another study that showed that it's not just a matter of reducing shootings there and moving them elsewhere. Actually, it's about changing the mentality in our youth and changing the norms of that culture of violence, which is so important for us to do. And those studies have actually shown that Safe Street changes those norms. Not to mention that for us, whenever I meet our Safe Streets outreach workers, I'm humbled and awed by them. Many of these individuals are recently released from incarceration. They're former gang members and drug dealers who recognize that they've done something not so great in society, and they want to give back. And for a lot of them, I remember actually last year when we were facing similar funding challenges too, I remember going to a meeting with them, and our Safe Streets employees, some of them were crying. These are grown men who were crying, who were saying this is the first time that they've held a job in the formal economy. This is the first time they feel like they're contributing to society, that they're able to provide for their family, for their loved ones, and they're proud of the work that they do every single day. So in terms of the impact of what would happen with Safe Streets cuts, we don't know what will happen exactly in the city. I can only give you the data from other places. In Chicago, when a program similar to Safe Streets called Cure Violence there was cut, there was a subsequent increase in crime and in shootings by about 30% in those particular areas. It's something that, again, we are proud of the work that we do. I'm proud of the individuals, and I'm also proud of the evidence and the data that's behind this incredible intervention.
Thank you, and I totally agree, and it means even more coming from a director whose budget is reliant upon data. You wouldn't be able to get the grants that you're able to get unless you were able to prove results, and so it's unfathomable that we would, a program that is proven to be successful in a city that unfortunately is so violent as Baltimore is. I can't imagine, hearing that, Baltimore is violent enough. Can you imagine where Baltimore would be without safe streets? It's incredible to think. I just had one other, maybe comment or question, and you don't have to answer this if you don't want, but every time I see the numbers of overdose deaths, 2016, 600 died from overdose. It is as if an individual who is illegally possessing or distributing fentanyl is more dangerous than a person who's walking around the city with a loaded handgun. And I can't understand why, someone who is illegally distributing fentanyl, I would think that if they found in possession of it for that purpose, should be charged with attempted murder. I mean, if you look at the statistics, they are literally walking through our streets with a loaded weapon. Like I said, you don't have to comment, but it just, there were 600 deaths last year, and we are still, if not for the efforts of your team with the naloxone, and we would be approaching a similar number this year. And so we've got to do something.
If I may address this quickly, because it's an important issue that you raised. Actually, the number of people in our city dying from fentanyl has increased by 20 times in the last 3 years. 20 times. This is really incredible. It's such a difficult issue for us to wrestle with when it comes to policy, and this is the reason. You're right. Fentanyl is so fatal. Even a few grains of it, and you touch it, could be fatal. There have been cases of law enforcement officials and first responders who have overdosed because they happened to touch some grains of fentanyl. Obviously, this is a major issue. The problem, though, is that many of the individuals who are distributing fentanyl are low-level distributors. They're individuals who are subsistence users, right? They're addicted to drugs themselves, and that's why they're distributing. And actually, a lot of them, from our speaking to folks who come to our needle exchange program, they don't know that they're giving out fentanyl. So it's also challenging because you're right, we have to address this issue, but do we want to further incarcerate individuals who have a disease? We did start something called LEAD in our city, Law Enforcement Assisted Diversion, which is offering people treatment instead of incarceration, which is really important. But I think very critically to this point, we also have to focus on treatment because there's a supply and demand issue, right? If people continue to be addicted, they're going to continue to seek out drugs. And now that those drugs contain fentanyl, they're going to be dying. So we have to focus on this issue in a whole number of ways. I also want to add something that, I was at a community meeting a few weeks ago. And the governor, as you know, has declared a state of emergency around opioids in Maryland. And I got a question which I didn't quite know how to answer. And the question was, I don't understand why there's a state of emergency now. There's been a state of emergency my entire life. And I think it does need to be said that the conversation has in part shifted around opioids because it's not just poor minorities in Baltimore dying, it's also wealthy white people in the rest of the state who are dying too. And I think recognizing the structural racism of how we've gotten to where we are with the war on drugs and so forth is important too.
No, and you're absolutely right. And you don't have to be the only one to say it. The face of overdose in some way has changed. And you're right, we've had this issue for years now. And it's only now that, white users in counties surrounding Baltimore are dying from it as well. Now it's become a crisis. It's been a crisis. And so, it's a shame that, it would have to come to that point for us finally to start getting some resources to address this problem that we've seen in Baltimore for a while now. So thank you, Dr. Wayne.
I haven't said this that much throughout these hearings, even though I agree with virtually everything that my colleague Councilman Pinkett has said over the last 37 hours, over the last 3 days. But I would like to take this opportunity to second the comment that he made on opioids, and to strongly second the comment he made on safe streets, without damaging the integrity of the negotiations that we're undergoing with the administration right now. I can tell you affirmatively that Safe Streets is a priority of the City Council. We are doing everything to make sure that that funding is restored. We think very highly of that program, without question. With that, Councilwoman Middleton.
Thank you, Mr. Chair. And I guess I'll start off with just piggybacking on what you just said about Safe Streets. And, you know, as a council person that has a Safe Streets, a successful Safe Streets program in the Park Heights community, it's just, they have been just doing a phenomenal job, and we want to keep that going. So first I just want to kind of make some comments, and then I just like your feedback after the comments. I also want to, you have just been a wonderful health commissioner for this city, and I know when you first came on board, your support with our liquor store epidemic, and kudos for the Be More Healthy Babies, and you know, we could just go on and on. So I thank you and your team for the wonderful work that you continue to do. And I also want to say that I'm a proud council person that's certified in the Naxalon. I know in my travels in areas that have high drug use, I just, you know, I feel good that I have that certification, so I can help someone that, you know, has an accidental overdose in basically any drug. So thank you for continuing, and I think everyone should try to get certified in that. My conversation is going to be around the school health nurses that basically are at its lowest in Baltimore City history. And this is our 4th day with budget hearings, and just to let you know, I have brought up the subject of apprenticeship because as a council team, one of our main charges is just trying to help find career skill sets for students that finish high school that, you know, aren't going on to college, and they're just left out there to eventually, you know, be a part of some of the problems. You know, they need jobs and they need skills. And you know, a school health nurse is just something that I remember as growing up. It's just so important. I know we have a program at KIP that's basically a private program, that Rails program, that has been very successful, and you know, they're helping with attendance and so on, and this is something that's also needed in all the high schools. I know there's a company called Dependable that basically, I think it's a contracted out company that I don't see how they have a vested interest in our students. And I guess to say that, I know there's about 12 schools that basically don't have a school nurse or a nurse's aide or just someone to help with the needs of students and keeping them in school. This is just such a critical situation right now, and I see it as a crisis. And I think I'm feeling, and I said this to basically all of the agencies as far as apprenticeship programs. As we have been listening to all of the agencies, there are shortages in jobs, and I'll say this again, we found out that there's a need in auto mechanics, electricians, carpenters, We just have one apprenticeship program in the city, and that is in the water and wastewater treatment, which is a partner with the union that's keeping it surviving. And we were, as a past director of the state's apprenticeship system, Baltimore City was the first government agency in the country to have apprenticeship program system. And I guess over the years, it just slowly faded away because, you know, it does take an assigned employee to work with trying to, you know, get the program started. It was at one time under the Labor Commissioner and Human Resources. We've had conversations with them this week. You know, everyone seems to be on board and interested in this program. We talked to the school system yesterday, and I gave this charge to her. She's in negotiations with the unions, and I gave this charge to, as you're negotiating, bring up apprenticeship, because they are the experts in this, and they work out and fund at least half of the actual process for apprenticeship. I feel that people, for some reason, they seem to be afraid of that word apprenticeship, but you need to really, I just see, at least start with maybe the health aides. We need people in these schools. The role of the guidance counselor has changed, so we need someone in the health profession, and I think it should be a city employee. They live, and for the most part, live in the city and work in the city, and we need to keep that going and not contracting out to, it's just, I think you're wasting more money. So I guess my charge to you is to consider that when you start your negotiations with Local 44 or CUB, or, you know, whatever organizations that you work with, and kind of keep that profession going.
Councilwoman Middleton, thank you so much for that important charge. You know, as you were speaking, I'm reminded that when I was first looking into careers, I mean, I didn't grow up in Baltimore, I grew up in LA, but I grew up in a family where we were immigrants. We didn't know, we didn't know anyone. You know, I didn't know what were the careers that were possible. I had this dream that I wanted to help people and become a doctor, but I had no idea what were the actual careers in medicine, how I would get there. And I think the same thing for public health. I mean, who knows about the opportunities, whether it's with school health, or whether it's with sanitation, or whether it's with lead inspection, or helping with asthma, or home visiting for babies, or helping seniors. I mean, these are not things that we get exposed to. And you're right, there needs to be pathways. So we're starting with our, we just launched last summer, very soft launch. We're doing much more this summer with the Public Health Leadership Academy. So we're going to our local high schools and recruiting high schools through YouthWorks, but also through other programs. We're working with a number of other nonprofits that already have like merit, that already are placing students in programs, and we in apprenticeships over the summer. And we have a few dozen students who are coming through this summer to at least begin to introduce them to what does a career in public health look like. We're working with Baltimore Core to recruit more individuals who are potentially here for college or graduate school to then stay. But I think you raised an important question, which is also, what is the workforce development that's present? Right? We cannot just be advertising for jobs at this level if we're also not doing jobs as community health aides and then having a path, so that there is a path that people can grow into, and once they do well and show that they perform well, that there is a path. There are incredible stories in our own department, including, I mentioned Olivia earlier about her work, and I wonder if you can tell us a bit more.
Yeah, I wanted to add, Councilwoman Middleton, thank you so much for that thought. Actually, over the past year, Francine Childs, our Assistant Commissioner for School Health, has been working on that, because it has been very difficult to hire and find bachelor's degree nurses. And so what we've done is created, and this has just happened in the past 6 months or so, that we've gotten DHR to create what we're calling a trainee position. And so someone with an RN, not necessarily a bachelor's degree, but just the RN, can come in as a trainee. And so we just hired our first trainees in the past couple of weeks, actually. So we're excited about that, and we think that that's a path for our health aides also to move up, another notch. So the apprentice idea is really good, and we're trying to work on it, and that's one piece of tackling that.
Thank you. That's great to hear. But I just want to add that plug that there is a partnership of money out there that helps in that, with
That's great to
building
know. Right.
So bring up that conversation in your negotiations. Thank you.
Thank you, Councilwoman. Councilwoman Sneed.
Good morning. Thank you again for Dr. Nguyen for all your help in answering our phone calls when we call. I feel like my office calls a lot for different things, and especially around what Councilman Pickett was talking about. And so I feel like if we could tackle the substance abuse users, we would have less drug dealers in our community. And so thank you for hooking me up with the behavioral health systems in Baltimore. But I'm curious, as I see the numbers, I know it's run out of them, but I'm wondering if you know how many people are on staff there, because here it says 0, and I know it's more than 0.
Sure. So I can certainly talk about that. So part of the structure that we have in the health department, I didn't mention this, but we also oversee several nonprofits in the city who are our contractors for various types of work. For example, Barks is our contractor when it comes to our animal shelter, and our contractor when it comes to behavioral health services in our city is Behavioral Health System Baltimore. They are our local health authority. In my role as the health commissioner, I also chair the board of Behavioral Health System Baltimore. So the budget that you see here is not the budget of BHSB. This is the budget that the city gives to BHSB as part of our charter, because we receive some money from state, we receive some federal funds, et cetera, but we also allocate a certain amount of our funds towards to form the city for behavioral health treatment. And so Behavioral Health System Baltimore has over 100 staff, somewhere between 100 and 150 or so staff.
And do you know how many of them are out in the community actually hands-on with addressing some of the, when we say overdose issues, or just getting people connected to get help?
So it's a complicated question to answer, and the reason is that many of those services in Behavioral Health System Baltimore are contracted out. And what I mean by that is, for example, Behavioral Health System Baltimore helps to deliver services, mental health services in our schools. But those services, those employees are not necessarily employees of BHSB. They're contractors of BHSB to deliver those services. So the majority of the work, the vast majority of the funding that comes to BHSB is given to community-based organizations that deliver those services on the ground. So you have organizations like Roberta's House that does services for trauma care, that is trauma care services that BHSB and others fund as an example. Our overdose work certainly is very much on the ground. We have teams that are teams of health department and Behavioral Health System Baltimore employees who do outreach work. Every time there's an overdose spike, and we get the data for the spike from the fire department, from police, from our nonprofits like Healthcare for the Homeless, we then deploy our outreach teams immediately to those areas on that same day to train on overdose, to get the word out about addiction treatment and so forth. So the work that we do is very much on the ground, but it will not be reflected in staff numbers because of the structure that's there in terms of contracting to other nonprofits and FQHCs that really do work on the ground.
Thank you. My other question is for the Environmental Inspection Services, Service 717. And I tell you, sometimes I walk past places and I'm like, I can't imagine that anybody would go in there and get anything from there. But so I'm wondering if 27 positions is enough to provide services for the whole city. Because if in my one little district, I feel like they should be shut down, is that enough for the whole entire city? And all of those 27 positions, are all of them filled?
Thank you, Councilwoman. The positions, 27 positions are related to animal control. We have 19 environmental health sanitarians, 12 of whom are assigned to food facilities, and 4 of whom respond to the kind of complaints that would come through the 311 system. So in answer to your question, for a city our size, just based on the number of food facilities and the number of inspections that are mandated by law, in a DHMH audit, they recommended, and this is also a federal FDA guideline, that we have 41.
Wow.
And that's only covering the piece that's the food facility inspection piece. So we have 4 officers then that respond to the hundreds of calls we get that could be anything from noise, odor, unsanitary conditions, many, many different types of complaints that come through the system that have to be responded to. And those actually typically take longer to address because many times they're ongoing issues.
Wow. So we're always behind, it seems.
I think that's a fair statement.
And so when we're going to these places and facilities, how are they inputting the information? Are they taking notes and then taking the notes back to the office to type?
For the food inspections, they actually use handheld devices that is transmitted, and then those inspection reports have to be viewed by a supervisor, and then they're activated to go online. So those are available to the public. The Ecology Complaints, which is the 4 individuals that handle, the kind of various complaints that occur, those are re-entered into 311. They are then, the notes would fall under the activities section in 311. Often with those, there's also a lot of follow-up in emails and communication around it as well.
Thank you. And my last question, it's around rats and the rat holes and basically how this is a problem all over the city. Every community meeting we go to, folks are saying, the rats, and it's like, what can we do? Because we have so many abandoned homes, and we talk about these rat holes, and then we talk about safety for our children who are playing in the streets and the alleys. It's such a concern for me, and I still squirm every time I see one or think about what's going on in our community. Again, what can we do to make sure that these homes are, I don't know, we just decrease the number?
Well, housing has several programs with regard to vacant homes, and the Department of Public Works actually has the rat eradication program. One of the big steps the city took actually was the delivery of the garbage cans with lids. It was a huge problem in our city. Many people were putting out trash. There weren't receptacles for this trash. It had a huge impact naturally on the rat population. DPW may be able to give you figures. I'm honestly not sure, but I do know that the goal of having the cans with the closable lids was to help with the rat issue.
For the abandoned homes, they mentioned something in reference to getting on the property. Is that what your office that will allow folks to get on to private properties is that through you guys' office?
Well, for us to enter private property, we would either need consent or we can get a warrant. And it's the same with housing. With DPW, they leave a notice, I believe, that lets the homeowner know that they're going to enter the back property to bait. Then that person would sign the card, and that would be the consent for doing the baiting.
Thank you.
We've been we've been joined by Councilman Slifer. Councilman Scott.
Thank you, Mr. Chair. Dr. Nguyen and all the health department, thank you for your exceptional service for the city of Baltimore. I actually, most of my questions have now been answered, but I just want to start out by saying that, of course, for me, Safe Streets is a top priority. Actually, it's my top priority in the budget this year. But I just want to go on record as saying that this year we are talking about restoring safe streets. I think next year should be a priority for us that we're talking about opening new sites. because we should have at least one Safe Street site in every police district. That will give us 9 Safe Street sites across the city, because we know it works, we know the impact it has, and we need to start to make that investment. We do recognize that public safety or violence in our city is a public health issue, and we have to start addressing it that way. We can't continue to do it the same way. And actually, Dr. Wynn, that leads into my next question. I think, and I asked the school CEO this question last night, that it's time that the city of Baltimore finally develop a comprehensive gun violence reduction strategy. And I think, personally for me, that in order to do that, that it has to be led from a public health lens, and that the leader of that should be our health commissioner. Actually, on Monday, I'm introducing a council resolution to call for a hearing as such, and so that I know that Dr. Wynn, you know about the NOLA for Life program in New Orleans that they have, where they look at all these different pillars, bringing in not just the city agencies, but outside organizations as well. And I think that the only way that Baltimore is going to truly see its gun violence be reduced over time and instantly is if we have a comprehensive strategy. We can no longer continue to just throw things at the wall and see if they stick. We can no longer continue to just throw cops on the dots and see if it works. We know that that's not going to work, not instantly, maybe for a little while, but we have to think about not just right now, but tomorrow, next week, 5 years from now. And we have to have that total concept of total coordination across all the agencies. And I just wanted to see what your thoughts was on that.
I know that Councilman Scott, you and I have talked about violence as a public health issue for quite some time. I'm actually very heartened to see that this is something that the entire council, from all my conversations with all of you, that you really believe that it's, we cannot just look at someone. I mean, I'm trained as a trauma ER doctor. Certainly, if somebody came to me in the ER with a gunshot wound, it's my job to treat that person. And absolutely, we want to prevent that bullet from reaching the person at the moment that it's being shot. But there's a lot more that we can do much earlier in order to prevent it from happening. And you're right that using data, using evidence, using science is something that works in other places and that we would be very much committed to addressing. This is, as you said, an all hands on deck effort, something that will involve the community, absolutely needs to integrally involve law enforcement, but taking the public health approach is so important as well. I think that we discussed actually at a previous council hearing the idea of going upstream in all of this. And it reminds me of the fable. You have 3 friends who are walking along a river, and they see children float by who are drowning. The first person jumps in and starts to rescue these kids. The second person sees a dam that's broken further upstream and tries to fix the dam. The third person keeps running, and the other 2 shout after him, "Why are you still running? These kids are dying right now." And he says, "But I want to see who's throwing in the kids in the first place." And I think that's what that public health approach can help us to do. How do we improve the lives of our children and our youth and our families to prevent them from reaching the point that they're in my ER, in our ERs, getting treated for their gunshot wounds?
Thank you for that, Dr. Wynn. And just my second question is about Service 717. Of course, we all know that health inspections are a very important thing in my eyes. And this is really for the mayor's office of Mr. Klein. I know that I say this every year, but we cannot continue to add positions to other services across city government and not add health inspectors. We know the benefit that they do for the citizens. We can see now with the advent of the information being public how valuable the citizens think they are. These are our most popular posts on social media. It's one of our most shared things. It's one of our most viewed data sets. People think this is important. And if we were investing in these health inspectors so that more inspections can be done, I think that, one, we would hold more of our businesses accountable. We also would generate some revenue for the city. But more importantly, we would know that people were being safe. Because we have to think about this. In some of these neighborhoods, we like to talk about food deserts. That corner carryout or that corner store is the only food source. And if that corner carryout or that corner store has food that has been damaged by rats or mice or insect infestation, think about the ongoing effects for that for a young kid who gets all of his food from that location, right? Who then goes to school and then he has learning issues. He can't focus. 5-10 years from now, that young man is ended up the victim of a gunshot because he couldn't focus in school. He couldn't read on grade level. He didn't graduate from high school. So all of those things are interconnected, and we have to think about that when we're creating new positions, and we know that positions are great for having new lawyers and being able to stop the city from being sued and analyzing the budget. All that's great, but we talk about taxpayer dollars and being well spent. They would be well spent for us to increase the health inspectors in the city. Thank you.
Councilman Burnett.
Thank you, Mr. Chair. Thank you, Dr. Nguyen, and to your staff for the great work that you do for the city. I just had so most of my questions had also already been answered. I'd like to, I don't know if we're on like a fourth or fifth for support for Safe Streets. It was a very informative public safety hearing, especially for me to hear directly from the outreach workers. I think it was last week that we had them in. Another program that kind of caught my attention in Service 316, Youth Violence Prevention. It also looks like there was a significant loss of funding for Operation Safe Kids. Can you talk a little bit about that program and the impact of nearly a loss of $2 million to yet again another service that would prevent violence before it occurred?
Absolutely. Thank you, Councilman Burnett, and thank you for your advocacy too for health and in general understanding that violence and so many other issues have their foundations as health issues too. The Operation Safe Kids was actually something that was cut from the last budget, and it was it's reflected in this budget because of how we're closing out the accounts and so forth, but it was actually cut as of last year. This was a state program based on all state funds that our state agency has decided to reallocate. And it was something that I actually, one of the first things that I did in my job was to attend the farewell party for our staff, or not the farewell party, but the farewell for our staff who are part of Operation Save Kids. And these are individuals who worked with kids who are the most at risk to prevent them from incarceration and also from being victims of violence. And it was very hard to do that. In one of my first days on the job, I'll always remember that moment because it was hearing the stories of how many kids they had helped and seeing them now go to other places as a result. And I think this again, I think illustrates the point that has been raised over and over that so many times we look at the interventions that we see. I mean, we see the person who was shot, we see the police presence on the streets. I mean, all those are important things for us to address. I would never argue for less, trauma treatment or whatever, but it's also important for us to think about 2 steps, 3 steps, 4 steps removed from that. How can we continue our investment in those programs that prevent people from getting to the point of requiring help for their gunshot wound?
Yeah, and I think when I talk to communities in my district, this is something that I think there is a disconnect there on the linkages between these programs. There was an article in the Sun earlier this week from a business leader that said don't cut the police because of the impact that it'll have on violence, and I started getting a lot of calls from community leaders in support of that. But one of the things that I explained to them as well is that police are inherently reactionary, right? Like you call the police after something has occurred, and really not that we shouldn't look at more efficiencies in any agency, but it's also important to make investments in programs that are trying to stop the decision to pull out a gun in the first place. And a lot of those we've already discussed are linked to investments in lead health, et cetera. All of these things are critically important, and so. And it's also something I mentioned in previous hearings as well, that while I recognize that this was previously cut and state funded, it was also something that I think as a city we should look to try and restore funding for these kind of programs when we can, so that your agency isn't completely reliant on grant funds and the impact that that has on our city is that these programs just go away and the work just stops, and then we're still trying to figure out how to pull the pieces together. So. Again, sad to learn, that this is something that, yet again, we is not a resource for our young people.
Thank you. And Councilman, this is the same issue that we face for all of our programs because we are so heavily grant dependent. This is a challenge that we face for everything, that we know programs that are effective, like our home visiting program. It saves money, it reduces violence, and increases our educational opportunities for children. Lead poisoning reduction also saves money. It also improves educational outcomes. It also reduces workplace violence. But we're totally, when we are completely reliant on grants and not on city general funds for some of these programs, it does present a number of challenges. So thank you for raising that point.
Thank you.
Chair, recognize Councilman Dorsey.
Safe streets.
We're going to take a 5-minute recess and come back because we have other council people who have questions. They have to step out for a minute.
Thank you.
5-minute recess.
And your staff have done a wonderful job in addressing some of the hot issues in Baltimore City. But to my council colleagues, and I truly support safe streets, and I hope my colleagues, we can add some extra money to safe streets, because in the 12th district, I have a lot of violence, but there's no safe streets in the 12th district. So to my colleagues, hope we can add some extra money so we have something over in 12. Also, I also want to mention, we talk about food desert, bank desert, but I also have a senior citizen programming desert in my district. I have 4 senior buildings, which are 2 seniors and the other 2 are population, and there are no senior programming in that area. At one time, at the Oliver Multipurpose Center, there was a senior program. Unfortunately, it moved up to up near Southern Baptist Church. So right in that 4-block area, I have 4 buildings with seniors. So I would like for maybe the council or Dr. Nguyen, you can look at that also, because at one time the seniors had, they went on trips, they did crafts, and right now there's nothing in that square block radius.
Thank you very much, Councilman Stokes. I'd like to address your question regarding safe streets first, because we get requests from members of the council, from state delegates, state senators, and other folks all the time about starting new safe street sites, which we would be very excited to do. And actually, we've had proposals, including from our universities and hospitals and businesses, to start safe street sites. Again, I would love to do it. The problem is that we also need to figure out, and what we have said as an agency is that we need to figure out sustainability for our existing sites, because it would be irresponsible for me to start a new site, even if we have funding, unless it's guaranteed funding for sustainability of our existing sites, because otherwise we run into the problem that we have this year and in years past of what do we do with our outreach workers who are already employed with the work that's already being done. So we would love to work with you and the other members of the City Council to increase our Safe Streets presence, with the caveat that we would love to figure out a sustainability plan, ideally through city funds, in order to achieve that. To your question about seniors, it's actually a similar problem as we've been talking about for all the other services, which is that we are facing significant cuts from state and federal grants. The federal landscape is incredibly uncertain. I mean, I think, again, we read the news all the time, but just our federal landscape when it comes to healthcare, I mean, the work that we do, as you can imagine, is maybe not the most popular with this new administration. HIV services for LGBTQ people, I'm not sure is a top priority. Our work to help with the most vulnerable individuals with healthcare will likely be cut as well. Because we're so heavily dependent on grants, I mean, we have $100 million, dependent on grants. If these grants are going to be cut, we will be looking to you to find assistance for what we can do to protect our most vulnerable. We lose money every year from the state when it comes specifically to seniors as well. We faced a cut to senior centers. We face other cuts because the distribution is not based on need. It is not based on poverty. It's based on a formula that's really per population, which is not appropriate, and that's a significant problem. So we do look to all of you for your help with advocacy and also with increasing care to our most vulnerable. And I'll turn to our Deputy Commissioner overseeing Aging and Care Services to explain some of the senior services that we have.
Thank you for your question, Councilman Stokes, and also thank you for your leadership and advocacy for seniors in the 12th District. I know that services for seniors, we do so much with so little. If you look at Service Area 721, you'll see there's $2 million allocated to senior centers to support all 14 senior centers. That includes 6 city-operated senior centers with capital improvement funds, operations, programming, et cetera. And then we also support the other 8 senior centers, including Greenmont Senior Center Services in your 12th district. We recognize that there are a lot of work that needs to be done, but we also partner with a lot of members in the senior buildings within your districts as well. We encourage seniors in the 12th district to call our MAP call center if they need information and assistance. This call center is available 24 hours for older adults, and we can direct them to the appropriate services as well as other services that are applied at the Greenmount Senior Center.
The good thing, I would love to sit down with your office in Hopkins, because I've been having a conversation with Hopkins called Community Conversation, which is trying to bridge the gap between Hopkins and East Baltimore, and it's been real good. So I would love to sit down with your office in Hopkins and maybe to get them to fund some of the programs I was just talking about.
I'd very much welcome that. Thank you.
Thank you.
Is that it, Councilman Cohen? Councilman Yitzhak.
Thank you very much, and thank you guys for being here. It's always nice to see you guys. I just wanted some clarity, and I'm sorry if I missed it, on the role of BARCs within the health department, and what services they provide that's not currently being provided by some of the private shelters and private groups that deal with that.
Sure. I will turn to our Assistant Commissioner Mary Beth Haller for the further description. I will mention again in general that the way that we work in the health department is we have, and the same with other agencies as well, is that we have certain nonprofits that are quasis, meaning that we designate they're nonprofits by statute, but they're quasi-governmental agencies because we contract out the work that needs to be done to those entities. Behavioral Health System Baltimore is one of them. And BARCs is another one, and I'll have Mary Beth explain more to you the relationship between animal control and BARCs, and how BARCs is different from the other shelters in our city.
Well, the Office of Animal Control and BARCs are housed together currently at Stockholm Street. The Animal Control Office actually responds to SR complaints. Those are the 20,000 calls that we're getting every year. Once we have those animals, though, in need of care, they're then transferred to BARCs, which is co-located. They do everything regarding medical, the feeding, the care, returning animals to the homes of lost animals. They house animals brought in from, for example, dogfighting rings that are collected. They have veterinarians on staff, and they provide all of that. They have adoption services, spay-neuter clinics, low-cost immunizations for our residents. And the difference between BARCs and the other area shelters is that many shelters can have the option of turning away animals. They can be what they call a no-kill shelter. And that's really attractive when you want to give money. You want to give money to a no-kill shelter. The problem is that leaves a lot of animals that are injured, unwanted, that may not be exactly suitable for adoption. And in some cases, animals do have to be humanely euthanized. So that is also a function, but the euthanasia rate since BARCs has been there, has gone from about 89% to about 2%.
And so could you, do you know offhand how much money goes to BARCs from the budget? Because I was looking through and all I saw were the increases for this year. I just didn't see the total amount that's actually going to BARCs.
It's approximately 1.2 million.
And what's their annual budget in total?
Well, they depend a lot on other giving, but I believe the most recent was about 4 million.
About 4 million, okay. And so the 1.2, would you say that is going towards covering these services, like following the SR numbers and providing those services that otherwise wouldn't be provided?
Well, these are the services that the city, it is the duty of the health department to provide under the city code. The care of animals, the quarantining of animals, for example, If there are dog bite cases, animals have to be quarantined because of the potential for rabies. So these are actually core public health functions. The idea was that animal control would essentially deal with the actual rescue. Those are the officers that are on the street, that are going into those homes, that are finding the animals, that are bringing them in, that are working the almost quasi-law enforcement side.
Right.
Barks receives the animals and has to provide all of that care. So that budget is covering their food, medical care, and it can be extremely expensive, in particular when you have a particularly horrific act of animal cruelty in terms of medical care.
Right, so I've seen those guys out on the street, and they actually do a phenomenal job. Are those guys, are their salaries part of that 1.2, or is their salary separate through the?
They're separate. They're part of the general funds budget of animal control.
So the 1.2 is direct to providing specific services, or is that just a general allocation? Because I'm just trying to understand what, how we figure out how much we're paying versus the services they're providing. There's no doubt they're providing, services that we need. The question just is that 25% of, the services they're providing in total? Are we, subsidizing other things, or are we just covering, specific services? Like if we went from 20,000 calls last year to 50,000 this year, or if we went in reverse, from 20,000 to, let's say, 2,000 calls, does that change the allocation that we're giving them?
It doesn't.
It doesn't, okay. So the money, there's just a blanket allocation, and it's
a blanket
not tied to any performance or anything else?
Well, it's a blanket allocation and primarily pays for positions, for staffing.
Okay, and what staffing positions are they if they're not the animal?
Well, they have veterinarians, they have veterinary technicians, they have outreach workers, really many different positions, everything from clerical to the people that are working directly with the animals, feeding the animals, walking all of the animals. There are just a huge variety of positions in running a shelter. All of those shelter operations are covered by barks.
And do we provide allocations to other places, let's say like the SPCA, or are we exclusively only in with Barks?
Barks is the sole contractor because this really is a city function. It's just been contracted out to Barks.
Gotcha. And so do you guys review that every year or something to say, hey, here's the volume versus what's going on? Okay.
Yeah, yes, we do.
Yeah, if I can add too, because so I'm a human medicine expert, not an animal expert, and so in coming here, I've relied a great deal on our incredible team, including Mary Beth Haller, Olivia Farrow, our director of animal control, Sharon Miller, to understand this, because this is not my area of expertise. But the way that I understand it is, animal control and Barks, that function for every city is together until you decide to separate it. And it was decided years ago to separate those functions, but it's still together under the rubric of the health department, because that is our duty to provide for those services. Similar to what we do for health and behavioral health, et cetera, right? That we separate out, but it's still under the rubric of the health department. Animal control is the front lines. We are the paramedics, the EMTs, if you will, right? So if there are any cause for distress for animals that are injured and hurt, or animals that are potentially victims of abuse and violence, and there have been some horrific cases of dogfighting and animals that were otherwise very cruelly abused and murdered. I mean, those are the calls that we receive through animal control. Once they're rescued, they have to go somewhere, and the sheltering is what Barks does. So it's like the ER, and that's the reason I think of it, because I'm an emergency physician, as the ER, because the ER, we can't turn away any patients, right? I mean, anyone who comes in, you would treat. And the same thing when it comes to Barks. It's different from a private hospital that can choose to select which patients are going to have cardiac surgery on their wards. Maybe this is too medical of an analogy, but you know what I mean, that we don't, the reason we contract with Barks is this is the city shelter where we cannot turn anyone away. SPCA and other organizations that are wonderful, they'll come and assist with Barks and often take a lot of these animals that they see as the most adoptable. But we still have to contract with the entity that takes in all animals, regardless of how they came about. And our animal control officers, again, this is an issue that I don't know much about, and so I've learned a lot by going along with ride-alongs, and we encourage all of you to do some ride-alongs if you're interested. But they've done some just incredible work, including when we had the snowstorm. Our animal control officers stayed in the shelters for days, because they're the ones who needed to provide care for these animals. They go out to some pretty dangerous areas. I mean, the people who are cruel to animals are probably not that great to humans either. In fact, we know that there's a high correlation, and so the work that they do is really incredible and should be considered as frontline core services in the city.
Yeah, and just on a closing note, I mean, I do agree with you on that, and like I said, I've actually been out there on scenes with some of those guys, and they do phenomenal work, and they, you know, they really do care, and they go above and beyond. You know, my questions are just in general tied to, and this isn't just with you guys, this is with any agency, with the services being provided, is how those, the dollars spent are, you know, corresponding to that. Because I mean, I think a goal for all of us would be that there'd be zero animal cruelty, and if that were the case, and there was zero animal cruelty, and you weren't getting any, you know, anybody putting in 301 requests for this, and you went from 20,000 calls to zero, you know, would we still be spending 1.2 million on that? Which, you know, it's sort of, you look at any other dollars that are spent on anything, there's just services tied to the allocation for those services, and if the services don't need to be provided for, are we adjusting them? You know, is there a specific, you know, formula that's being used rather than just a set allocation?
The answer is yes. I mean, for us, every year as we review our budget, we go through every single line item as a team, and Ryan has been, of course, has led the effort this year and last year. We go through everything. Our budget is extremely tight, as you've seen from everything. I mean, we do a lot with 28 million. That's all that the city general funds are allocated to our agency for FY17. We do a lot, and we have to make a lot of trade-offs that often are difficult. I mean, what do we fund? Asthma or animals or lead or HIV? You know, these are very difficult choices, and so we do make the best decisions that we can at the time, but we also do very tight evaluations and constant evaluations, in part because we're so limited, and with the threat of grants going away all the time, we always are evaluating what is the best use of our resources.
Thank you.
Thank you.
Thank you, Dr. Wen, for your leadership, and thank you to your team. 2 points. One, as I mentioned to you before, I was just in a meeting with a group of 8th graders from Southwest Charter who are very concerned about lead paint poisoning. Dr. Bullock, who was in the room at the time, asked how many young people had either themselves or someone that they were close to had elevated lead levels, and half the hands went up. My hope is that we can become a lead-safe city so that we're not continuing to produce Freddie Grays and other young people, because I think the research has become increasingly clear that lead paint poisoning has severe neurological effects, and I believe contributes to the violence we see in our city. So that was the first point, is how can we get there? And my second question is more of a political question, and it's around changing the narrative on crime and violence toward being a conversation about health, which is something that I know you have sort of championed and I think done very well in the city and in the United States Congress. But it's to say that what we deal with a lot is constituents that are upset because of crime in our city. Often the response that we hear is, therefore, we need more police, which I believe that police are part of the answer, but I do not believe they are the full answer. I believe the issues that we have in crime are about concentrated poverty, are about segregation and our deep institutional legacy of white supremacy in this city, and are about lack of opportunity. And I think it's really important that we are able to reframe the narrative and explain to folks that crime cannot just be solved by police, and I know we have police coming up after this alone, but that this is about so much more, because right now folks in our city, and I know Chairman Scott shares this view, are very upset, as they should be, about crime and violence, but I think collectively we need to figure out a way to speak about it where it is about promoting health and wellness and reducing harm and reducing violence. And so I'm wondering if you have any thoughts on how we can shift the discourse and have a more holistic conversation about what we all can do to reduce crime and violence in our city.
Thank you, Councilman Cohen, for those really well-framed questions. The first about lead. You know, it's so difficult. This is one of those issues that I've seen patients, I've seen little kids being brought in by their parents who are lead poisoned. And it's a completely preventable issue. It's very difficult to look at these parents in the eye, look at these kids in the eye and say, actually, we knew that this was a problem all along. This just wasn't done, and now you're suffering lifetime developmental impacts. I mean, lifetime lower IQ, lifetime impacts of of decreased education, maybe even speech motor defects. It's extremely difficult. There has been a lot done in the last 15 years, 20 years in the city, including very aggressive enforcement, which is important because, you know, unlike Flint, and I think this is an important point for our group, unlike in Flint, where the issue was with lead poisoning from pipes, we thankfully don't have that problem in our city. In our public pipes, we don't have the lead that caused the poisoning in Flint. Our problem is with peeling paint, with older buildings that unfortunately still have lead in paint. And so there is a lot that we still must do in order to, first of all, test kids. There is a requirement for universal testing for children, ages 1 and 2 in our city, and we need to increase education to test kids, because once we identify them as being lead poison or potentially, I mean, any amount of lead in a child is unsafe. So that testing is really important to identify the problems. But even more so, we have to prevent people from getting poisoned in the first place. We don't just want to pick up a problem after they got tested. And so there is a lot more that we have to do still with education about peeling paint, with enforcement with landlords and so forth. So I think that those are all continuing efforts that we want to keep on working on. The reframing the narrative around violence, your second point, completely true. We very much agree with the public health approach to violence prevention. We talked about safe streets earlier. I would also add that very closely related to the issue of violence is mental health and addiction. That unless we look at even our people in prison, that we have 4 out of 10 people in our jails have a diagnosed mental health illness. 8 out of 10 people use illegal substances. We have this culture with this tradition of incarcerating people with a disease. I mean, which you would never do for anything else. You wouldn't say, oh, you have diabetes, let me put you in jail and see if that's going to fix it. We really need to focus on mental health and addiction. We have to focus on trauma. And I'll just tie this back to something that I need your assistance with. We have been very fortunate to receive a number of grants related to trauma. Actually, over the years, Department of Justice also helped to fund programs like Safe Streets. With trauma, we've had Department of Education grants in recent years, SAMHSA grants. I mean, we're very glad to have these grants. But again, with the changing federal landscape, that is going to go away. I can't promise this, I certainly don't want this to happen, but I suspect that these grants are no longer going to be sustained in our city. And so I need your help to continue to reframe the narrative, as you so well said, so that if these programs are shown to be successful and if they do have long-term effects on reducing violence, then we need to sustain them here in our city.
Thank you, Dr. Nguyen. Thank you all for coming out. Thank you for answering our questions. And we're just going to reset. Go ahead, Council President.
Thank you, Madam Chair. I was responding to a complaint, but I just wanted to ask about animal control. How many animal control vehicles do you have?
We have 10.
10? Okay, is that adequate? Because I know I called one time and they said they'd only had 2 trucks on the street.
It's not so much a question of the fleet, it's the actual officers that are able to respond. We have very few animal control officers. We have 15. There's 3 shifts.
They have to be off.
You know, and it's 24/7.
Okay.
So at any given time, our goal is to have 4 officers for the morning shift, 4 for the afternoon, and then 1 at night. But it's dangerous work. Sometimes there are injuries.
Do you have any vacant positions that need to be filled?
We actually have a vacancy now that we have been interviewing for.
Okay. Do you have an adequate amount of animal control officers to do their job adequately?
No, in fact, it's really a struggle, and they often have to do double shifts.
Okay. Let me ask this question. What was your numbers like 5 years ago?
5 years ago.
You can just get that back to the committee.
It
You know,
was-
because I want to see whether they cut positions, because, you know, we get complaints from constituents all the time.
Yes.
And dead animals are diseased, laying on the street, and we have to protect our citizens.
I can
So
tell.
we need to know how many of those positions were cut.
I can tell you, Council President, that there were 2 dedicated drivers that were doing dead animal pickup, and both of those positions were cut in 2013. And that meant that the burden of
If
having
you can
to...
just get that information to the council, appreciate it.
Council President.
Mr. President, there are 3 positions added in this budget.
Were you aware of that? 3 positions added to the budget?
The 3 positions there was actually a reduction last year, and this is a restoration of those positions.
Oh, okay.
And Council President, thank you for bringing up this point, because it illustrates our overall point that whenever we are at current level of service, it actually is a cut to our budget. So we do have, whenever it says CLS, it looks like it's the same budget as before. But because of increasing costs, and also because of our grants that are increasing, but our operations that are not increasing, we end up having to make cuts from somewhere. And it's always very challenging, because what do we do? Do we cut animals, or do we cut restaurants, or do we
Right.
cut lead, or do we cut violence? It's a very challenging role for us to be in. Thank you
Okay.
for...
Well, I'd like to
Mr. President,
get with you.
I hate to contradict the commissioner, but current level of service does make adjustments for pay increases and other inflation.
Okay. Well, I'd like to get with you to look at some of the fees that we could look at raising, so that we can take care of some of this stuff. Because I'm going to tell you, citizens complain all the time that they call and they can't get these dead animals off the street. But I can truthfully tell you that I called, and the gentleman was very, very nice. He said, look, we only have 2 trucks, 1 east and 1 west, and we're going to do our best to get there. And they got there. You know, it wasn't during the time the constituent wanted, but they got there and got it. And the constituent was very happy. But they get unfairly, talked about, and don't really know that it's not that many to be out there to pick up these dead animals. And we have deers now that's getting hit, especially over in West Baltimore. And people call about those deers laying on the road, dead possums, all kinds of dead animals, because their habitat is being taken away, and they have to come in now. So we've seen foxes. Next we'll see dead foxes in the street of Baltimore, and we need to have animal control out there to pick them up when they're killed. Thank you.
Thank you, Council President. Okay, we'll recess for 5 minutes, and then we'll hear from the police panel, the Law Enforcement Coordination, and Law Enforcement Mayor's Office of Criminal Justice, Baltimore Police Department, and the State's Attorney's Office.